Surgery is a sacred trust. When you go under the knife, you put your life in the hands of skilled professionals. But what if they falter? Surgical errors can have life-altering consequences. And today we're diving into the 10 most alarming surgical mistakes that have rattled the medical world. 1. Wrong site surgery. Imagine waking up to find that the doctor operated on the wrong part of your body. This startling error is more common than you might think. In 2014, a patient scheduled for a right knee surgery woke up to discover that the team had operated on his left knee instead. How would you feel if your doctor left you with a life-altering mistake? 2. Retain surgical instruments. It sounds like a horror movie scenario, yet it happens. Surgeons closing a patient up only to realize they've left a scalpel, sponge, or clamp inside. One notorious case involved a woman who underwent a routine laparoscopic surgery only to experience intense pain years later. Doctors discovered a surgical clamp still lodged inside her. Would you trust your surgical team again after such an incident? 3. Anesthesia errors. Errors in anesthesia can be fatal. In 2015, a young girl was supposed to undergo a simple procedure. Due to a mix-up, she received the wrong dosage and fell into a deep coma. Thankfully, she eventually woke up. But what risk do you feel every time you're put under? 4. Nerve damage. During a typical shoulder surgery, surgeons mistakenly sever a nerve. A patient attempted to regain movement and functionality for 2 years, but was left with permanent weakness. Would you be willing to take the risk, knowing that a single error could change your day-to-day life forever? 5. Infections from contaminated instruments. Patients expect sterile environments, but surgical tools can harbor bacteria. One horrifying case involved a patient who developed a severe infection after routine surgery. The surgical instruments had not been properly sterilized. How do you feel knowing that negligence could lead to a battle with a life-threatening infection? 6. Operating on the wrong patient. This is perhaps one of the most shocking errors. In 2007, 2 patients in the same hospital scheduled for similar procedures were mistakenly operated on. One patient had an organ removed that wasn't his. How would you react if you learned that an error cost you your health? 7. Overlooking allergies. What happens when a doctor neglects a patient's documented allergies? One woman received a medication she was allergic to during surgery and went into anaphylactic shock. Tragically, she survived but was left with lasting health issues. How important do you think it is to disclose all your allergies to your surgical team? 8. Intubation errors. A seemingly routine procedure can turn fatal if intubation goes wrong. In one case, a patient did not receive adequate oxygen due to improper placement of the breathing tube, resulting in brain damage. Would you be able to trust your medical team knowing such critical errors could occur behind closed doors? 9. Miscommunication among staff. The operating room is a high-pressure environment, but that doesn't excuse miscommunication. In one case, a doctor scrubbed in for a procedure believing it was a benign cyst removal. It was actually a tumor. The results were devastating. Would you trust your surgical team if you knew they hadn't communicated effectively? 10. Poor documentation. Surgical notes are key in ensuring continuity of care. In one instance, a negligent error in documentation led to a patient receiving the wrong treatment after surgery. This oversight not only jeopardized recovery, but extended the patient's hospital stay significantly. How safe do you feel placing your trust in a system that can fail to document your care accurately? These stories serve as stark reminders of the risks associated with a surgery and the importance of raised awareness. Each error shines a light on the critical need for better communication, safety protocols, and patient involvement in their own care. Ask yourself, how prepared are you to advocate for your safety during a medical procedure? Stay vigilant and informed. Remember, your health is your responsibility. And as we wrap up, take these lessons to heart. Stay safe, stay aware,